Hey there, and welcome. In this explainer, we're going to tackle one of the most important and sometimes challenging conversations you'll have as a pharmacist, talking to your older adult patients about vaccination. Let's jump right in.
You know this patient. We all do. Let's call him Martin. He's 72, he feels great, he's active, and in his mind, he absolutely does not need any vaccinations. This right here is the healthy patient paradox, and it's probably the biggest hurdle we need to clear.
So, what's really driving a patient like Martin? It all comes down to this number. A staggering 96% of older Canadians say they will do whatever it takes to avoid moving into a long-term care home. That's it. That's the core value. Our conversations aren't just about avoiding a bug. They're about protecting their independence.
So, how do we connect the dots between a vaccine and that independence? Well, it starts with understanding why Martin's age, just the number itself, is his biggest risk factor, even if he feels fantastic. Let's get into the science you can use to build that case. Okay, so the first big concept is immunosenescence. It's a bit of a mouthful, I know, but it's really just the natural, age-related weakening of the immune system. It means their first-line defenses are slower and their long-term immune memory isn't as sharp. It leaves even the healthiest older adults way more vulnerable than they think. And it's not working alone. There's this other process called inflammaging. The best way to think about it is like a low-level, chronic inflammation that's just been simmering in the background for decades. Every time they get an infection, it's like turning up the heat on that simmer, which further weakens their immune system. So preventing infections with vaccines helps keep that fire low. And all of this leads us to frailty. Now, frailty isn't something that's guaranteed to happen with age. It's a state of being vulnerable, of having less in the tank to bounce back from a hit. And what's one of the biggest hits an older person can take? You guessed it, a serious infection. And here's what that looks like in the real world. This is the cascade of decline we're trying to stop. A patient starts at their normal baseline, then bam, an acute stressor like the flu hits them. They get better, but they don't quite get back to where they were. Their new baseline is lower. Another hit, another drop. This is how independence is lost, step by step. Okay, let's bring this back to Martin. He thinks his daughter with asthma is the one who's really at risk. But look at this data. For ending up in the hospital with the flu, Martin's age is a 2.4 times higher odds factor than her asthma. For death from the flu, his age is a 28% higher risk factor. The numbers are crystal clear. His age is the real danger here. Okay, so that's the why. We get it. Now let's get into the what. Here is your quick and simple guide to the latest NACI immunization recommendations for your patients who are 65 and older. When it comes to the flu, NACI is now very specific for this age group. To get around that immunosenescence we talked about, they have a preferential recommendation for the enhanced vaccines. So high dose, adjuvanted, or recombinant. They just plain work better in an older immune system. Use them over the standard dose if you can. Now for pneumococcal vaccines. The good news is the guideline has gotten a whole lot simpler. The latest update is clear. Every single adult 65 and over should get one dose of a higher valent conjugate vaccine, like PCV20 or 21, and that's regardless of what they've had in the past. And to round things out, let's quickly cover the other big ones. For RSV, it's a single dose of an approved vaccine. For COVID-19, at least one dose a year, and bump that to 2 for those 80 and over. And for shingles, everyone over 50 should get Shingrix, even if they had the old Zostavax or already had shingles. All right, you've got the science, you've got the guidelines. Now for the really important part. How do we actually use this information in a real conversation? Let's walk through some of the most common questions you're going to get. This is probably the number one thing you hear, right? Oh, it's no big deal, I just get colds and I'm fine. They're lumping everything together. So our job is to gently, but clearly, pull them apart. Your go-to response here is super simple. It's all about the lungs versus the nose. Colds usually just hang out in your nose and sinuses. But influenza, COVID, and RSV, they love to go deep into the lungs. And that is what lands older adults in the hospital and kicks off that whole cascade of decline. Okay, here's another classic. I already got a pneumonia shot. And you know, they're not wrong. They probably did. They feel like they've already checked that box. So how do we explain this update without making it confusing? Honestly, the easiest way to explain this is to use an analogy they already get. You can say, you know how there's a new, much better shingles vaccine now? Well, it's the same idea for the pneumonia vaccine.
These new ones are just built differently to give a stronger, longer-lasting protection, because we know the protection from that older one really starts to fade after about 5 years. So you've done it, you've convinced them, but then they look at you with wide eyes and say, wait, you want me to get all of these shots? You can just see the logistical barrier going up in their mind, all those trips to the pharmacy. And your answer can be super confident and reassuring. Just say, yep. And the best part is, we can do them all at the same time in the same visit. It's totally safe, it's effective, you get protected faster, and it's just one trip. It's all about convenience. So let's pull all of this together. The real takeaway here isn't just about a list of vaccines or a new guideline. It's about shifting our perspective on what our role is. We are on the absolute front lines when it comes to keeping our older patients healthy and independent. I want you to really let this sink in. Your role isn't just about giving shots. It's about protecting a patient's independence, their quality of life, and really their entire future. Every one of these conversations is a chance to do just that. So the next time a patient like Martin comes to your counter, you're not just seeing someone who needs a vaccine. You're seeing an opportunity to protect everything they hold dear. You have the science, you have the guidelines, you have the words. The only question is, are you prepared for that conversation?